What is the primary role of a home health aide? A. To make medical diagnoses. B. To perform surgery. C. To assist clients with daily living activities. D. To prescribe medications. Answer: C. HHAs help clients with personal care, hygiene, and routine activities, not medical diagnosis or prescriptions. Which of the following tasks can a home health aide perform? A. Administer intravenous medication. B. Assist with bathing and grooming. C. Prescribe medication. D. Change complex wound dressings. Answer: B. Assisting with bathing and grooming is a key duty within the HHA scope of practice. What should a home health aide do if a client refuses care? A. Force the client to comply. B. Ignore the refusal. C. Report the refusal to the supervisor. D. Argue with the client. Answer: C. Any refusal of care must be reported to the nurse or supervisor immediately. Which of the following best demonstrates proper infection control? A. Wearing gloves only during meal prep. B. Washing hands before and after patient care. C. Using hand sanitizer only at shift's end. D. Sharing towels with clients. Answer: B. Frequent and proper hand washing is critical to preventing infection. What is the normal oral temperature range for an adult? A. 95 to 96 degrees Fahrenheit. B. 96.5 to 99.5 degrees Fahrenheit. C. 100 to 102 degrees Fahrenheit. D. 98.7 to 100.3 degrees Fahrenheit. Answer: B. The normal range for oral temperature is approximately 96.5 degrees Fahrenheit to 99.5 degrees Fahrenheit. If a client is nonverbal but appears in pain, what should the aide do? A. Do nothing unless the client speaks. B. Tell the client to ignore the pain. C. Document the signs and inform the nurse. D. Offer food as distraction. Answer: C. Nonverbal signs of pain must be documented and reported to the nurse promptly. How should a HHA assist a client who is falling? A. Hold them up with force. B. Let them fall and walk away. C. Ease them gently to the floor. D. Run for help first. Answer: C. Aide should ease the client to the floor safely and protect their head. Which action helps prevent pressure ulcers? A. Letting the client remain in one position all day. B. Keeping skin moist. C. Repositioning the client every 2 hours. D. Using tight bedding. Answer: C. Frequent repositioning helps reduce pressure and improve circulation. When lifting an object, a HHA should: A. Keep knees straight and back bent. B. Use back muscles only. C. Bend at the knees and lift with legs. D. Twist the body for support. Answer: C. Safe lifting involves bending at the knees and using the legs, not the back. What is the purpose of a care plan? A. To teach the aide how to cook. B. To provide detailed medical training. C. To outline care needs and responsibilities. D. To schedule aide vacations. Answer: C. The care plan outlines exactly what care tasks the aide must perform. Before taking a client's radial pulse, the aide should: A. Shake the client's hand. B. Ask the client to raise their arm. C. Ensure the client is resting. D. Take the temperature first. Answer: C. The client should be relaxed and still before pulse is measured. What is the best way to communicate with a hearing-impaired client? A. Speak loudly and fast. B. Turn away while talking. C. Face the client and speak clearly. D. Shout repeatedly. Answer: C. Facing the client and speaking clearly helps them read lips and hear better. What is one sign of elder abuse a HHA should report? A. The client sleeping a lot. B. Unexplained bruises or injuries. C. Forgetfulness. D. Wrinkles and dry skin. Answer, B. Bruises or injuries without explanation may be signs of abuse and must be reported. A client asks the aide to keep a secret about drinking alcohol. What should the aide do? A. Keep it private. B. Joke with the client. C. Report the incident to the supervisor. D. Ignore it. Answer, C. Anything affecting client safety must be reported, including alcohol use. When assisting a client with a walker, the aide should ensure A. The walker is behind the client. B. The walker is at elbow level. C. The walker is used only on carpet. D. The client walks without shoes. Answer, B. A walker should be adjusted so the client's elbows are slightly bent. What is the correct way to measure liquid output? A. Estimate by eye. B. Use a graduated container. C. Record only what the client remembers. D. Use a teaspoon. Answer, B. Always use a marked measuring container to record fluid output accurately. How should a HHA handle a client's confidential health information? A. Share it with neighbors. B. Tell coworkers at lunch. C. Keep it private and share only with authorized personnel. D. Write it on social media. Answer, C. Confidential information must only be shared with those who need to know. A client suddenly becomes unresponsive. What is the first action? A. Shake the client and yell. B. Call 911 and notify the nurse. C. Put them to bed. D. Give them water. Answer, B. In an emergency, call for help immediately and notify the nurse. When feeding a client, the aide should A. Rush to finish quickly. B. Let the client eat while lying flat. C. Sit the client upright and feed slowly. D. Ignore food preferences. Answer, C. An upright position and slow feeding reduce the risk of choking. What should the aide do if the client has diarrhea? A. Stop giving food. B. Offer extra water and report it. C. Leave the client alone. D. Only give milk. Answer, B. Diarrhea can lead to dehydration, so fluids should be encouraged and the issue reported. What is the best way to help a client maintain independence? A. Do everything for them. B. Encourage them to do tasks they can manage. C. Avoid asking what they want. D. Take control of their care. Answer, B. Encouraging self-care supports the client's dignity and independence. How should a HHA respond to a combative client? A. Restrain them. B. Stay calm and report the behavior. C. Argue with the client. D. Leave immediately. Answer, B. A calm approach reduces escalation and ensures safety while proper reporting follows. What should be done if a client complains of chest pain? A. Offer a warm blanket. B. Have them rest and wait. C. Report immediately and call emergency services. D. Give food. Answer, C. Chest pain could signal a heart emergency and must be reported without delay. Which statement about body mechanics is correct? A. Bend at the waist. B. Keep the load far from your body. C. Keep feet shoulder-width apart. D. Always twist when turning. Answer, C. Proper posture and footing reduce injury risk when moving or lifting. What is an example of neglect? A. Giving meals on time. B. Assisting with bathing. C. Not responding to a call light. D. Giving medication as instructed. Answer, C. Failing to respond to care needs like call lights may be considered neglect.